Hi, everybody. I'm Dr. Bryan Ardis. This is the Dr. Ardis Show, and we're so excited to have you today with us for this special presentation. This is all about what you need to know about heart failure. What are the causes of heart failure? And then what would anybody who's either been diagnosed with heart failure, has family histories of heart disease, what would you do proactively before ever having a heart episode? Or what would you do after you did? Is there anything you would do preventively to actually increase the odds of survival for longer periods of time without the looming threat of a stroke or a heart attack? So that's what we're going to do right now. And this is going to be kind of new. I've never actually done this. In the years of podcasting, never have I tried to do a presentation in 30 minutes or less. But here goes. We're going to see if we can give you enough information to help you make informed decisions about things you may be able to do at home to improve your health outcomes in relationship to the heart itself, and then how to prevent worsening things ever happening in the future for those of you who have been diagnosed with either heart episodes or have congestive heart failure or any kind of heart disease you've been diagnosed with. This show is for you. It's very, very exciting what we've learned, and I'm excited to give this to you. Remember, at the Patients Resources tab, the entire PowerPoint I'm about to present is in there for free. You can just go download it. All right, so here we go. Let's dive in. This is What to Know About Heart Failure by yours truly, Dr. Ardis. Remember, scan the QR code. This will actually bring up a web link that allows you to put in your email, and you'll be notified by email whenever we're introducing a new topic, a new speaking event, a new book signing, whatever it is we're doing. If you want to stay abreast on what we're educating people on, we have an entire 6-month calendar of topics we're going to be presenting information about, life-saving info every week for the next several months. If you want to be abreast of when those are coming out, get on our email list. All right, so let's discuss heart failure. This is directly from the Heart Failure Society of America's website. Heart failure facts and information. Heart failure is a progressive condition in which the heart's muscle gets injured from something like a heart attack or high blood pressure and gradually loses its ability to pump enough blood to supply the body's needs. That's the definition. Heart failure is a growing problem in the United States. Yeah, this is why we're doing the show. Current estimates are that nearly 6.5 million Americans over the age of 20 years old have heart failure. One major study estimates that there are 960,000, that's almost a million, new heart failure cases every year. Not only is heart failure a major problem affecting many people, heart failure is also a major killer. Heart failure directly accounts for about 8.5% of the heart disease deaths in the United States. And by some estimates, heart failure actually contributes to about 36% of all cardiovascular disease deaths. Now, truth is, the heart stops, you're dead. Anything wrong with the heart, they call heart disease. And there's like a billion things they define as heart disease. You're talking about heart failure here, and that's what we're talking about in general. What are the risk factors for heart failure? Says the Heart Failure Society of America. Here's the risk factors. High blood pressure, fat deposits creating blockages in the heart arteries, heart attacks called myocardial infarction, damage to the heart valves or history of a heart murmur, heart muscle disease and enlargement of the heart, that is called cardiomegaly or cardiomyopathy, heart defects at birth, that's congenital heart disease, family history of enlarged heart, diabetes, obesity, sleep apnea, and severe lung disease. What are the most common medications prescribed to people with heart failure? Number one is angiotensin converting enzyme inhibitors. That's the long form for the abbreviation you all know called ACE inhibitors. So ACE inhibitors, as you see, examples include enalapril, known as Vasotec brand name, or Epined. Lisinopril is the generic name of Zestril or Cubrellis, and the generic drug called Captopril. Fun fact, all ACE inhibitor drugs that end with pril are actually venom from a snake in Brazil called the Jaracus viper. And they've been selling snake venom in pill form since 1981. And by the way, all snake venom ingested in the human body causes every form of cancer on earth. So if you are prescribed an ACE inhibitor, you should ask your medical doctor, do you believe my high blood pressure is caused by a snake venom deficiency? Next class of drugs is angiotensin II receptor blockers called ARBs. They include losartan, that a lot of you know about. That's the generic name of Cozar. Valsartan, another name for the brand name Diovan, and candesartan, another word for the brand name Atacand. Atacand. And then there's ARNIs. These are angiotensin receptor plus neprilysin inhibitors. I'm not going to define those. Beta blockers, all of you have heard of. These include carvedilol, Coreg, metoprolol, known as Lopressor for a brand name, Toprol XL, Capspargo Sprinkle, and bisoprolol. So metoprolol is probably the number one most well-known, Lopressor. And then diuretics, known as drugs that make you pee. You'll hear the term water pill. This is such as furosemide, which is Lasix, or Furosix. These are diuretics to lower blood pressure for heart disease and heart failure. Surgery options for heart failure include coronary artery bypass graft surgery. All of y'all have heard about bypass surgeries. What they don't tell you. Let's dive into what they don't tell you about these drugs and these surgeries. Zestril is the brand name, as you see, of the generic drug highlighted called lisinopril. This is Zestril, what the drug packaging looks like. Its generic drug is lisinopril, and it looks like this. For healthcare professionals, if you go to drugs.com, what you don't know about lisinopril, made from snake venom, what you don't know are that, look at this cardiovascular published side effects. Very common. 10% or more of people in trials, it was exactly 11% of all people given this drug who had heart failure, developed life-threatening hypotension, low blood pressure. If you look at the common side effects of lisinopril, did you know up to 10% of all people on these drugs in drugs trials experienced, when they didn't have it before, chest pain, angina, chest pain, orthostatic hypotension, and palpitations, all of which are symptoms of heart disease? Did you know that 1 in 10 people on lisinopril in drug trials experience these as a side effect to the drugs? Did you know that the liver section called hepatic side effects of lisinopril drugs? Did you know that up to 10% of all people on those drugs will see their kidney enzymes go to elevated risk levels? The next drug for congestive heart failure is Entresto. That's the brand name of the drug called valsartan. So I just showed a picture of valsartan here, the drug, but most people are familiar with valsartan. If you're on valsartan, did you know that this was medically reviewed by this lady, Carmen Pope? But let's dive into the research. Did you know this important warning exists about valsartan? Did you know that this drug acts directly on the renin-angiotensin system and may cause fetal, that's baby, injury or death? Well, I don't know about you, but if this kills babies in utero, what is it doing to you as an adult? We found that as an alarming side effect. When you go into the more general, more common known side effects of valsartan, you'll see the cardiovascular effects. More than 10% of all people, 18% to be exact, will experience life-threatening hypotension, low blood pressure. This will make you dizzy, have vertigo, imbalance, you'll fall. Up to 10% of all people have orthostasis, which is another cardiovascular problem. Can't manage your blood pressure. That's up to 10% of all people. Did you know that it's very common that up to 16% of all people will have elevated potassium, higher than you should? That will cause kidney failure. Did you know that they will have hyperkalemia? Over 12% of all people. This is excess calcium being deposited in your ligaments, tendons, and blood vessels. Did you know that it's very common? Up to 16% of all people on valsartan will start experiencing on their blood work increased kidney markers, evidence of renal failure or acute kidney failure, into 10% of all people on this drug. 1 in 10. When someone prescribes valsartan to you, you should ask your medical doctor if kidney failure is right for you. Did you know it also causes, in up to 1% of all people, angioedema, which is swelling of the face, lips, heads, eyes, ears? Did you know up to 10% of all people will experience, and that's 20% of all, will experience hemoglobin or hematocrit decreased greater than 20%? Did you know that more common side effects of valsartan is 10% of all people on it will start experiencing falls? How many of you have a loved one that's on valsartan for heart disease and they can't stand, they keep falling? Did you know 10% of all people on this drug in the drug trials only were falling? This is angioedema. At the top, you'll see that's what it looks like before and after. This is called Lopressor. This is the Generic drug is called metoprolol, and lots of people are on this. Lopressor is the brand name. That's what it looks like. It's called a beta blocker. This is metoprolol, the generic version. Did you know that it is published? Read this. This is actually a warning to doctors prescribing the drug. The most common adverse effects of metoprolol reactions were tiredness, dizziness, depression, shortness of breath, bradycardia, a symptom of heart failure, hypotension, low blood pressure, life-threatening, diarrhea, pruritus, and rash. Itchy skin is pruritus all over the body. How many of you knew that this drug, metoprolol, being used for a heart disease problem, causes bradycardia and life-threatening low blood pressure? And these are the most common side effects. But this isn't even the most alarming. Did you know that heart failure is a very common side effect in 27.5% of all people put on Lopressor or metoprolol? Hold up. This is on drugs.com. This is what your medical doctor is supposed to be reading before he prescribes you a drug. Anybody that has congestive heart failure or been diagnosed with a heart issue like high blood pressure or blood thickening, and they put you on Lopressor or metoprolol. Did you know it is known to science that cardiovascular-wise, it is very common, up to 27.5%, that's over 1 of 4 people, will develop heart failure, meaning your heart stops, you die, as a result of the drug. Its own side effect, 28% of all people will develop heart failure. Does that shock you? This is a very common side effect of Lopressor and metoprolol. Ask your doctor if heart failure is right for you. Did you know that hypotension, low blood pressure, less than 90, the top number, will occur in up to 28% of all people on that drug? I thought low blood pressure or heart blood problems was a genetic disorder. Did you know bradycardia, a heart rate less than 40 beats per minute, which will make you pass out, fall, go into a coma, blackout, will occur to 16% of all people on metoprolol or Lopressor? Ask your doctor if heart failure, low blood pressure, and bradycardia are right for you when they prescribe metoprolol. Did you know that up to 10% of all people or more will experience cold extremities, artery insufficiency, blood flow won't move, palpitations, first-degree heart block, second or third-degree heart block, and postural disorders, meaning if you change positions, you can't stand, you can't walk, you're going to get dizzy and fall. Ask your doctor if metoprolol is right for you. Did you know that up to 10% of all people on metoprolol will experience dizziness, vertigo, stroke, headaches? Did you catch that? Up to 10% of all people, that's 1 in 10. Well, was your loved one put on metoprolol or Lopressor and then start falling, having strokes and headaches? Did you know 10% of all people on that drug will develop a rash all over their body and develop itching skin that drives them crazy? Did you know up to 10% of all people on metoprolol and Lopressor are diagnosed with depression? 1 in 10. Did you know that people that have bypass surgery, we're going to show you this, risk factors for death of patients undergoing coronary artery bypass graft surgery, commonly known as a bypass surgery. Of a total of 1,628 patients undergoing coronary artery bypass grafting, 141 of them died during surgery. Did you know 9% of all people in this study died while having the procedure to save their life? I wonder if they would have died without it. They went in there alive. Did you know that? I thought that was crazy. What are the risks of coronary artery bypass surgery? Bleeding during or after the surgery, blood clots that can cause heart attack, stroke, or lung problems. Those are published side effects of bypass surgery. Infection of the incision site, pneumonia, breathing problems, pancreatitis, kidney failure, abnormal heart rhythms, failure of the graft, death. How many of you knew that this was the published on Johns Hopkins website, the most common risks of coronary artery bypass surgery? Ask your doctor if death, abnormal heart rhythms, kidney failure, pancreatitis, blood clots, and bleeding during surgery are right for you. Let's look at the all-natural ways to improve your health. This is the published connection between magnesium and heart health, understanding its impact on cardiovascular wellness. In this study, there was 7,172 men aged 45 to 68 participated in the Honolulu Heart Program, where 24-hour food recall techniques were employed to assess magnesium intake. Both studies discovered a link between a lower incidence of coronary heart disease and a higher dietary magnesium consumption. The more magnesium they ate or swallowed, the lower the incidence of heart disease. Food magnesium intake was found to be inversely linked with death from coronary heart disease and ischemic strokes. I repeat, the more magnesium people ate, they had a decrease in death from coronary heart disease and ischemic strokes. Ask your doctor if magnesium is right for you. Here's the effect of a short-term magnesium supplementation on anxiety, depression, and sleep quality in patients after open heart surgery. Based on a clinical trial, 60 candidates were given open heart surgery and were separated into control groups and an intervention group or a supplement group. In the intervention group, 500 milligrams of magnesium was administered daily in the form of 250 milligram magnesium oxide tablets for only 5 days. The results: after magnesium supplementation, the average level of magnesium in their intervention group was significantly higher in their blood work. At the end of the study, the average level of anxiety and depression was significantly lower in the magnesium group than the control group. Moreover, sleep quality improved in the magnesium group compared to the control group. Conclusions: due to the effects of magnesium supplementation in patients after heart surgery, it is recommended that this supplement be included in the treatment plan in order to prevent anxiety, depression in these patients after surgery and improve their quality of sleep. Ask your doctor after any of your loved ones have had heart surgery if magnesium is right for them. It is. Remember, it's on the periodic table of elements. You learned long ago it is a required element that makes up all life on Earth. You need magnesium. Here's the next study on magnesium: relationship between dietary magnesium intake and the incidence of heart failure among older women. The World Health Institute. Compared with those in the highest quartile, the group of unadjusted dietary magnesium intake, women in the lowest group, those getting the least amount of magnesium, had 1.32 times higher the hazard of incidence of heart failure in a fully adjusted model, the hazards of which decreased in a linear fashion with higher dietary magnesium intake. Let's break that down into simple terms. When we looked at women with heart disease, the more magnesium they took, the less they had for all markers of heart disease. Lower unadjusted dietary magnesium intake was significantly associated with higher hazards of heart disease functionality. So the lower the dietary magnesium, the worse their heart health outcomes. If you want to see the thing there, HFrER means heart failure with reduced ejection fraction. So less blood's being pumped out of the body with the least amount of magnesium you're taking. Vitamin C and heart health, a review based on findings from epidemiological studies. One analysis of a bunch of research studies showed more promising results with vitamin C supplemented looks at its effects on blood pressure. This analysis looked at 29 different human trials with an average dose of 500 milligrams daily of vitamin C. The average duration of supplementation in these trials was only 8 weeks. That's 2 months, people. But in these short-term studies, it was shown that vitamin C supplementation reduced both systolic and diastolic blood pressure. Overall, these meta-analyses demonstrate that supplementation with vitamin C may improve endothelial function, the lining of your blood vessels, and reduce blood pressure. Vitamin C may also reduce arterial stiffness. The hardening of your arteries increases blood pressure. If you make them more pliable with vitamin C, you reduce blood pressure and it reduces the stiffness of your arteries. All of you know that they'll take a ultrasound, run it over your neck, and look for calcium deposits in your coronary arteries. Calcium is bone. That means your arteries are turning into bone. They're becoming stiff. Vitamin C may also reduce artery stiffness. Ask your doctor if vitamin C is right for you. Dietary vitamin C deficiency is associated with health-related quality of life and heart event-free survival in adults and heart failure. This is vitamin C. There were 59 cardiac events, 3 cardiac deaths, and 56 cardiac hospitalizations during the follow-up period to this trial looking at vitamin C, with 31 events in patients with dietary vitamin C deficiency and 28 events in those who had adequate dietary vitamin C intake. Cardiac event-free survival, no heart attacks during a period, was significantly worse in patients who had dietary vitamin C deficiency. More people died when they were low in vitamin C. Patients with dietary vitamin C deficiency had a shorter cardiac event-free survival. So the time frame between when they started, when they had one heart attack to the next one that killed them, that time frame of life was reduced in the people who were vitamin C deficient, compared with those with dietary vitamin C adequacy. Do people with heart failure and heart attacks want to live shorter or longer lives? If you want to live longer, it's already proven vitamin C supplementation works. Boosting endogenous production of vasoprotective hydrogen sulfide. Just pay attention. Hydrogen sulfide is something the body makes that helps to protect your arteries and blood vessels from a stroke, from plaquing, from artery rupturing called aneurysms or strokes. They give credit to something called hydrogen sulfide that prevents that. They're about to discuss in this paper how supplementing with taurine and N-acetyl cysteine increases hydrogen sulfide production to protect the heart from cardiovascular disease. Research has established that hydrogen sulfide is generated by enzymes within the body and functions as an important modulator of physiological function of the heart. This hydrogen sulfide is important for the function of the heart. As you go down into this study, you will see on the page, H2S as hydrogen sulfide has been found to decrease the inflammation of your arteries and the skin inside of it called endothelial cells, suppresses white blood cell adhesion inside the arteries, that's blood clotting, amplifies your vasodilation of your blood vessels, which lowers the blood pressure, decreases the formation and inflammatory activity of foam cells in the blood. It inhibits smooth muscle migration, so increasing the health of your smooth muscle of your arteries and blood vessels. It inhibits vascular calcification. We just talked about calcifying of your arteries. This reverses that. And it reverses thrombogenesis, which is the development of blood clots. In this study, they enrolled 120 pre-hypertensive subjects, those with high blood pressure going up, who were randomized to receive 1.6 grams of taurine daily or a placebo for 12 weeks. Blood pressure was assessed both at clinical visits and by 24 hours of monitoring. In the taurine group, the average blood pressure reductions were significant relative to both placebo and the baseline. So both parties, they checked their blood pressure when they started, and even that group, the ones that received taurine, their blood pressure improved from the beginning, and so did the placebo. The placebo group did not react. For both systolic and diastolic blood pressure, the high and low numbers on your blood pressure both were improved by an average of 7 or 4 points. Both the endothelium-dependent and endothelium-independent vasodilations of your arteries was amplified in the taurine group. So anything relaxing blood vessels was improved in the taurine group. But the truly intriguing finding was this, they say, plasma hydrogen sulfide levels in the taurine group, which protects against heart disease, rose from 43.8 micromoles per liter at baseline, start of the study, to 87. That is double after 12 weeks. A virtual doubling of plasma hydrogen sulfide. Ask your doctor if taurine supplements are right for you, because they are. In regard to N-acetyl cysteine, it has been suggested that the elderly have an increased requirement for cysteine owing to the fact that the efficiency of glutathione synthesis and glutathione tissue levels declines with age. Supplementing with NAC in the elderly may provide health protection by boosting the production of both glutathione and hydrogen sulfide, each of which is crucial for optimal physiological function and health promotion. NAC may be of particular merit for rejuvenating immune function in the elderly and alleviating the symptoms of the flu. Any of you battling the flu, you might want to start supplementing NAC because it helps to reverse it all. This is a study on NAC and its protection during coronary artery reperfusion, or the surgery for that. I just want you to know the infarct size where the heart attack occurred in the NAC group, those all shrunk. You'll see at the bottom that last highlighted sentence, infarct size at 3 months, and reported a significant reduction with the NAC treatment, with the infarct size in the NAC group being 5% on average. You could reduce the size of these in 2 different trials they figured out. Did you know that atrial fibrillation is a published side effect of this procedure, post-operative atrial fibrillation? The incidence of this was reported in 9 trials with a total combined patient number of 490 of them for the NAC group and 484 for control. Atrial fibrillation is a big deal. When you look at the last statement on the screen, the analysis of multiple research study points to a reduction close to 50% in the incidence of post-operative atrial fibrillation with NAC treatment alone. If you supplement NAC, atrial fibrillation does not occur in over half of the people that take it. So ask your doctor if NAC is right for you during any coronary artery surgeries and after. It is. This is another study on N-acetyl cysteine, oral N-acetyl cysteine as an adjunct, an additive to standard medical therapy, improved heart function in cases with stable class 2 and class 3 systolic heart failure. Compared to placebo, NAC more significantly improved the systolic left ventricle function, expressed as the term you will hear, everybody, with a cardiologist, ejection fraction. In parallel with the improvement of left ventricular function, right ventricular function expressed as RV, fractional area change, and RV index also got more improved in those receiving NAC than those receiving placebo. Everybody listen to me. If you have a loved one with heart failure, they are checking their ejection fractions every time they go in. NAC improves left ventricle and right ventricle ejection fraction issues. Additionally, at week 12, the distribution of the New York Heart Association functional class also shifted toward a better outcome in the NAC group in comparison with the placebo group, which is amazing. Ask your doctor if NAC is right for you. This is a study about taurine supplementation, improving functional capacity, myocardial heart oxygen consumption, and electrical activity in heart failure. Only looking at heart failure. Those diagnosed with heart disease being given taurine. The objective of this study was to evaluate the effectiveness of taurine supplementation on functional capacity, myocardial oxygen consumption, and electrical activity in patients with heart failure. In a double-blind and randomly designed study, 16 patients with heart failure were assigned to 2 groups, the taurine group and the placebo group. The taurine group received 500 milligrams of taurine supplemented 3 times per day for just 2 weeks. The results: significant decrease in the values of the QT wave segments and significant increase in the values of the PR wave segments, significantly higher values of taurine concentration, T wave, QT segment, physical capacities, and lower values of cardiovascular capacities were detected post-supplementation in the taurine group as compared with the placebo group. Just so you know, these QT waves, the T waves, these are all a part of the, when you see an EEG or an ECG of your heart, you'll see these waves, these measurements, QT, PRST wave. Those are all improving when you take taurine. Read these next statements. Taurine significantly enhanced the physical function and significantly reduced the cardiovascular function parameters following exercise. Our results also suggest that the short-term taurine supplementation is an effective strategy for improving some selected blood dynamic parameters in heart failure patients. This next study is going to discuss more benefits of taurine. If you want to read these, you can. It's incredible. I'm trying to keep this down to 30 minutes. Remember, you can download this entire PowerPoint slide. I just need to remind everybody here of this one thing before I summarize this PowerPoint. This is titled The Therapeutic Effects of Google and its constituent, gugolsterone, found in the plant extract called Google, and its cardiovascular benefits. Just want you to know, they're quoting animal studies where they took gugolsterone at ranges from 5 milligrams to 100 milligrams per body weight. And they found that within 10 days, they saw a decrease in cholesterol, triglycerides, LDL, bad cholesterol binding to cells, and that was all significantly decreased when you saw those. Glucosteroid lowered blood cholesterol and triglycerides by 27% and 30% respectively in just 10 days. There's more to its benefits to lowering LDL and increasing LDL. Further analysis of blood lipid proteins, which is LDL, HDL cholesterol, indicated that the increase in total cholesterol was due to the increase in high density lipoprotein, HDL, which is your good cholesterol, whereas LDL and VLDL were actually decreased. So when you saw any increase in cholesterol, it was only because good cholesterol levels went up, bad cholesterol levels went down with gugu lipid resin extract. They dive into more evidences of this incredible herb lowering blood pressure to prevent heart disease. I just want to highlight that at the Dr. Ardis Show, we have a product called CardioFlow. Its very first ingredient is gugu resin extract. You see it in there. You'll also see L-cysteine at 200 milligrams in there, and I just showed you N-acetyl cysteine is a cysteine that helps prevent all of these issues with heart failure patients. This is our magnesium complex. 4 capsules contains 400 milligrams. You saw the doses. This is vitamin C we just mentioned and reviewed in this study. This is 1,000 milligrams in 3 capsules. And then this is our N-acetyl cysteine product. 1 capsule a day is what we recommend. It has 750 milligrams. And this is taurine. Our taurine supplement, 1 capsule has 500 milligrams. You saw the doses in this presentation. Here's our QR code. Scan it if you would like to learn more. I am Dr. Bryan Ardis. I would like you to start asking your doctor if vitamin C, magnesium, taurine, N-acetyl cysteine, gugu lipid resin extract are right for you or your loved one who's been diagnosed with heart failure, gone through bypass surgery, or has been diagnosed with high blood pressure, or you are being told you will have heart disease most likely because your history says so because of your family. There is plenty of human trial evidence that nature wins. Ask your doctor if any of these supplements, herbs, minerals, or vitamins are right for you and your loved ones as they try to extend their lives as they've been diagnosed or cut on with procedures for congestive heart failure or any heart disease. I'm Dr. Ardis. God bless you. We'll see you next time on the Dr. Ardis Show.